Hello, my name is Mike Gajdelski. I'm a third-year pharmacy student. Today we're going to be going over the neuro examination. Again, we have our standardized patient, Ruth Ann Lieblich, and we're going to first go over the equipment that would be needed in order to perform this exam. Okay, so we have our standard ophthalmoscope. We have our tuning fork. We have several reflex hammers that we can use. The one that I prefer is going to be the round head hammer. It also includes a soft and dull point, sharp and dull point. The sharp is going to be on this end, and then for dull you would use this. This hammer does as well. The sharp is normally up here and the dull is going to be down here. And then lastly we have our standard reflex hammer that only has the dull point and not the sharp. Alright, now that I've entered the room like I normally would and cleaned my hands, I'm going to start asking the patient questions. This is pretty much to check if they're alert and oriented. It's going to be represented on your progress note as alert and oriented times 3. You're going to ask them a series of questions. So what we're going to first is ask them simple questions like, what is your name?
Ruth Ann Lieblich.
Okay. What is today's date?
July 17th, 2013.
Alright, and where are we currently?
We're at the Eugene Applebaum School of Pharmacy at Wayne State.
Excellent. Now next you would ask them a series of questions also for their cognitive function. We're going to ask her about the serial sevens, which is starting at 100 and counting backwards by sevens. So an alternative to that would be to ask the patient what is the most recent president and have them go backwards. So if you could start at 100 and go backwards by 7, please.
100, 93, 86, 79, 72,
65.
65.
Don't
Don't make me look bad.
Sorry.
Usually when they get down to the 70s, you can pretty much.
Okay. Well, excellent. Thank you, Ruth. Now we're going to ask you 3 types of recall. So what I'm going to do is I'm going to ask you immediate recall, recent, and then remote. Immediate, I'm going to give you 3 objects, and then I'm going to ask you at the end of the neuro exam what those 3 objects are. So the 3 objects I'd like you to remember are umbrella, taco, and puppy.
Umbrella, taco, and puppy.
Yep. Alright. Now as far as recent, you would ask them something like, what did you have for breakfast this morning?
24-ounce Big B coffee.
24-ounce Big B coffee. And then for remote, you're going to ask them, what high school did you attend?
Redford.
Now you'd have to know the patient in order to know that they're telling the correct answer, but Redford is where she went to high school. So the next thing we're going to do is we're going to start testing the cranial nerves. Alright, now that we've finished with the patient questions, we're going to start testing their cranial nerves. So we're going to first test cranial nerve 2, 3, 4, and 6, which has to do with the eyes. The eye exam that you performed in the HEENT portion of PCL1 is going to apply here. There's only one extra thing that we add, which is to test their peripheral vision. So you stand in front of the patient, and you're going to put your hands out to your sides, and you're going to tell them to look directly at your nose and wiggle one finger and ask them which one is wiggling.
That one.
Okay.
That one.
Okay. So everything is intact there. So next I'm going to check cranial nerve number 5, which is the trigeminal. So what this has to do with is sensation in the patient's face. The reflex hammer that I like to use includes a sharp object on the end, and then on the other side is the dull object. So what you're going to do is you're going to test 3 spots on the patient's face. You're going to ask them to close their eyes, and before you do that you're going to first demonstrate what sharp and dull is. So Ruth, could I have your hand please? Thank you. And I'm just going to quickly explain. Okay, this is going to be sharp, and this is going to be dull.
Okay.
Okay? So I'm going to ask you to close your eyes for me, please. And I'm going to test 3 spots on your face: forehead, cheek, and then outside the chin area. Alright, so when you're doing this, you first want to test sharp and then you want to test dull. So you're going to test bilaterally. So like I said, the points to work on are going to be the forehead, cheekbone area, and then outside the chin. So first we're going to test, please close your eyes for me, and we're going to...
Sharp.
Okay.
Sharp. Sharp.
Okay. And now we're going to do the dull.
Dull. Dull. Dull.
Now, even though I'm explaining to Ruth what I'm doing with the sharp and the dull, normally you wouldn't explain to the patient first. They'd want to respond what you're actually doing with the sharp or the dull. So the next part of the cranial nerve number 5 is going to be testing the jaw strength. So you can explain to the patient, I'm going to place my hands on the sides of your face and I want you to clench your jaw for me. And you're just testing to make sure that they have strength in the muscles for their jaw. So I'm going to place my hands here, clench it for me. Alright, and again, you're assessing this to see if there's any difference from the left side to the right side. Okay, next we're going to test cranial nerve number 7, and what we're going to be looking at is the strength of the facial muscles, similar to trigeminal, but we're going to be testing different areas. So you're going to explain to the patient first that you want them to close their eyes and try to keep them closed, and you're going to try to open them. So what I'm going to do is I would place my fingers here, say, Ruth, please keep your eyes closed. I'm going to try to open them. And you just want to, put a little tension on it, but not too strong. So the next thing you want to ask the patient is, could you wrinkle your forehead for me? Alright. And then you want to ask them, could you give me a real big smile? Alright, thank you. And then lastly, please puff out your cheeks for me. Alright. So the next thing we're going to test is the acoustic cranial nerve, which is going to be number 8. Alright, so now we're going to check cranial nerve number 8, which is going to be acoustic. This is a real simple test. We're going to ask the patient to close your eyes, and I want you to cover your right ear. Alright, so now you're going to hold your arm about arm's length away, and you're going to say, tell me when I start rubbing my fingers.
Now.
Alright, and then, okay, switch to the other ear, please, cover it. Keep your eyes closed.
Now.
Alright. So that demonstrates number 8, which is the acoustic. So next we're going to move on to number 11, which is going to be to check the shoulders and the neck for strength. So you're going to tell the patient, I'm going to place my hands on your shoulders, and again you're checking both sides at the same time, and you're going to ask them to shrug. Go ahead and shrug. Alright, thank you, Ruth. Now next thing you want to do is you want to check their neck strength. So you're going to place your hand on their face, and you want to make sure to cover the whole face. You don't want to have it down here or too high. You want to have your knuckles about on their cheekbone. So go ahead and oppose it. Thank you. And you're going to do the other side. Alright, excellent. So lastly we're going to check cranial nerve number 12, which is the tongue. So if you can just stick your tongue out for me and wiggle it around, please. Alright, thank you. And we're going to move on to testing the sensation and vibration of the extremities. So in this part we're going to check the touch. Similar to when we were testing the face for sharp and dull objects, we're going to use the same part of our reflex hammer. And what we're going to do is we're going to have the patient close their eyes, and you're going to test several locations on their body. You want to test their arms, so just their lower arms, and then you're going to test their hands, and then you want to move to their thighs, and then to their calves, and then to the top of the feet. Alright, so with their eyes closed, you're going to check bilaterally again, so you can switch between sharp or dull, it doesn't matter. You just want to kind of, not trick them, but to make them actually think about what you're touching them with. Alright, Ruth, if you could close your eyes for me. So again, I'm going to demonstrate what sharp and dull is. Okay, that's going to be sharp, and that's going to be dull.
Okay.
Okay, so we're going to first test your arms. Alright, tell me what that is.
Sharp.
Okay.
Sharp.
Alright, now we're going to test your hands.
Dull. Dull.
Okay. Now we're going to test the thighs.
Sharp. Sharp.
Alright, the calves.
Dull. Dull.
And then we would check the feet.
Sharp.
And then the other foot.
Sharp.
Alright, so then now we're going to move on to testing for vibration with the patient. Okay, so now we're going to test the patient's ability to sense vibration. So we're using a 128 tuning fork. You'll notice this one's different than the other one, which is the 512 megahertz. So we're going to take this, and again, you never want to hit it on anything. You want to just pinch it in order to do it. So you can explain to the patient. What I'm going to do is I'm going to pinch the tuning fork, and then without touching the sides or anything on it while it's going, you're going to place it on the bony process here on the wrist. Alright, and I'm just going to ask you to tell me when it stops. Alright, so I'm going to activate the fork and place it on the bony process.
Stopped.
Alright, and then you would do the same on the other side.
It stopped.
Okay, so you're comparing it to what you're feeling, and then also you're comparing it bilaterally too. So the other two sites that you're going to check, we're going to do it just on one side to save time, but you would always check bilaterally. So we're going to next do the feet and the big toe. So we're going to pull out the tray so that way they can rest their feet up there. And whenever you touch a patient's feet, you want to make sure that you sanitize your hands afterwards. But we're going to go ahead and activate the fork. Again, have them tell you when it stops.
It stopped.
Okay, and then you would check bilaterally again. And then we're going to lastly do the big toe, which what we're going to do is we're going to do it on the joint right here. Alright.
It stopped.
Alright, thank you, Ruth. Alright, so now we're going to sanitize our hands and move on to the next part of this. Okay, next we're going to be testing to see the patient's ability to sense position. So we're going to ask them to close their eyes, and you're going to explain to them, I'm going to move your finger either up or down. So I'm going to support your hand, and you want to pinch on the side. You don't want to pinch here because it's easier for them to tell if it's up or down. So you're going to go here.
Up.
Alright. And then
Down.
alright. And then you're going to pull out the tray and you're going to test their toe. Please lift your legs for me. Thank you. Close your eyes again. And you do the same thing.
Down. Down.
Alright, thank you very much. Alright, so we're going to move on to the next part of the neuro exam. Alright, so next we're going to check the patient's strength. So it's just going to be a series of tests to look for their grip strength, and then also to see if they have cogwheel rigidity. Cogwheel rigidity is demonstrated by it's like a stopping motion as they're moving their arms up and down. So I'm going to ask Ruth, so what I'm going to ask you to do is grab my fingers, alright, and then I'm going to try to pull them away from you, and you can hold on to them, alright. Again, you're trying to test bilaterally to see if they have strength equal on both sides. So the next thing we're going to do is we're going to check your arms. So pull your arms away from your body. Alright, thank you. And then pull them towards you. Alright, good. Now put your arms out like this, please. So push towards me. Alright, and pull away. There you go. Alright, so next we're going to check the lower extremities. So we're going to check the hip first. Alright, other side. Thank you. And now we're going to check the legs. Push out. Okay, push out. And pull towards. Alright, thank you. Now I want you to lift your feet up and like you're stepping on the gas. Alright, again, in all those parts you want to check to make sure that they don't have any cogwheel rigidity and strength is equal on both sides. Next we're going to check the patient's coordination and balance. So we're going to ask them to do a series of tests standing in order to check their ability to have spatial recognition. So Ruth is already standing. You normally ask the patient to stand up, but I'm going to ask you to hold your arms out with your palms up, and this is called pronate or drift. You're going to tell them to close their eyes and just hold their arms out for 3 seconds. Alright, and what you're doing is you're looking, put your arms down for me, you're looking to see if one arm drifts or the other arm drifts. It's just going to be a difference on either side. Alright, so the next thing we're going to do is called the Romberg's test. So you're going to have the patient stand there, they're going to close their eyes with their feet together, and all you're going to do is just see if they sway. Alright, so close your eyes for me. Now you want to protect the patient to make sure if they do sway or they move or anything, that you can catch them. Alright, thank you, Ruth. Alright, so the next thing we're going to test is the normal walking gait, which is just going to be to have them take a few steps straight forward. Alright, Ruth, take a few steps straight forward for me. Alright, thank you. You turn around for me. So the last part of this coordination and balance standing up is going to be what's called the heel to toe gait, which is you're going to be asking the patient just to take a few steps heel to toe. Alright, please take a few steps heel to toe for me. Alright, thank you. So then now we're going to also check another part of the coordination and balance, but you're going to have the patient sit back down. Okay, this is a continuation of the coordination and balance. So we're going to ask the patient to do another series of tests. So you're going to explain each test before you ask them to perform it. So I'd like you to take your finger with your arm straight out and then touch your nose for me, please. Alright, and one more time. Okay, now do the other side, please. Alright. Again, you're always checking bilaterally. The next thing I'm going to have you do is I'm going to move my hand, and I want you to take your finger and just touch my finger. Okay? And the other hand, please. Alright, thank you very much. So the next thing you're going to have them do is touch their finger to each one of their thumbs as fast as they can. Alright, thank you, Ruth. And the last is just going to be the heel to shin rub. So just go ahead and rub your heel on your shin, and the other side, please. Alright, thank you. And this completes the coordination and balance part. We're now going to move on to checking the tendon reflexes. So the last part of the neuro exam is going to be to check the deep tendon reflexes. So there's 5 locations on the body, but there's, again, you got to check bilaterally. So the first one we're going to check is the triceps area. So with the triceps, you're going to tell the patient to hold their arm, and they want to put their full weight on your arm. So they don't want to be flexing at all because you'll never get it. So there's a space in between the 2 bones right here. Bone here, and then the elbow. You're going to take the hammer. You're just going to get a little bit. Alright? So next thing is you're going to have the patient lay their arm back down. Alright? And we're going to do the biceps one now here. So you're going to just go from the elbow and draw a line to the outside here. You're going to place your 2 fingers on it. And you're going to see the patient's arm move a little bit. Alright, the last one on the arm is going to be the brachioradialis, which is going to be just on the outside here. And the easiest way to find this is if you pull up the patient's thumb, you'll be able to feel the tendon right here. Alright, take this, and then go across it. Alright. So the next one we're going to check is the patellar reflex. So with this, you want to take it and feel the patient's kneecap and go straight down, and you'll find the space right there just below it. And take it. You want to hit a little harder because it is a deeper reflex. So The last one you need to do is you're going to take the patient's leg and support it. You're going to move the foot up. This is the Achilles reflex. You're going to move it back and then twist it inward. And hold it, and then take your hammer. And my foot's just going to move a little bit. Alright, again, you'd want to compare these bilaterally, and you're going to grade them on a scale from 0 to 4. 0 would be no response, 4 would be a hyper response, and 2 would be normal. This completes the neuro examination.